Viz basically ingests data from the CT scanner, like a CT angiogram, or from the EHR, the OR, the ICU, and it uses AI algorithms to automatically detect disease like a large vessel occlusion, measure disease like a CD perfusion mismatch, and predict disease like what might happen with that aneurysm. What it's really doing is it's making that healthcare data meaningful, which allows us to trigger action. We can connect patients to doctors, doctors to doctors, patients to clinical trials, and doctors to devices so much more quickly than was ever possible before. And this allows us to enable therapy. As you'll see through this presentation, it's resulted in improved clinical impact, clinical intelligence on what's going on in your health system and where you can improve, and also optimize clinical trials. It really allows us to synchronize healthcare, no matter where that patient shows up, hub spoke, rural or urban environment. Within minutes of the scan, the stroke team will be alerted about that patient. They'll have the relevant imaging information they need to assess that patient's eligibility for treatment, whether it's TPA, whether it's a thrombectomy, whether they should transfer the patient. They'll be able to communicate with their colleagues, the vascular neurologist and the interventionalist, all alerted at once and communicate.
Viz demonstrated to CMS reducing the time to treatment directly correlates to improved clinical outcomes and increased access care for patients suffering a stroke. So time savings, there are very good data coming out of Lucas and Adam's program at Semis Murphy. 44 minutes time saved, PSC door to CSC puncture. We have our data showing 66 minutes saved. J. Mako and Company with Joanna at Mount Sinai showed 33 minutes saved in their pre-viz, post-viz, comparing PSC arrival to INR physician alert time. Now, Don Fry and Michelle showed at Skyridge, so they installed Viz here, where you see this icon, and after that, 100% of their thrombectomy cases had, door to puncture time, less than 90 minutes. This is really big deal. I mean, this is very impressive. Kudos to them. This is very, very impressive. I mean, this is just a summary of all those time savings. Reducing the length of stay is extremely important. 55% reduction in neuro ICU length of stay. I mean, right? We're building units, we're expanding units. Any days I can save for a subarachnoid hemorrhage or someone who came in too late, right, and has cerebral edema or hemorrhagic conversion, or your ICH patients, it does make a big, big difference in a big practice. For the J. Mako and Joanna Fifi data from Mount Sinai showed the mean 5-day NIH and discharge modified Rankins with significant p-values pre-viz, post-viz. Right, 5-day NIH had a significant change, discharge modified Rankins, as well as 90-day modified Rankins. This is very, very impressive. Pre-viz 90-day modified Rankin of 5. That's basically bedridden. Whereas post-viz 3, you might be, you're not considered back to baseline, but you're still going around doing your own thing.